Okay, so this is an 18-year-old female. She came to the ED after road traffic accident. She is less responsive, GCS of 6, blood pressure of 182/98, pulse of 52, and respiratory rate of 6. On examination, she has unilateral dilated pupil and third nerve palsy. What's your immediate next step? So I will show you the choices and pause for 3 seconds. So if your choice is choice E, endotracheal intubation, then this is right. So this is a case of severe traumatic brain injury with elevated intracranial pressure and impending herniation. Why did we say severe traumatic brain injury? Because GCX is less than 8. And why did we say elevated intracranial pressure? We have the high blood pressure trying to counteract the new intracranial pressure and bradycardia, which is known as, yes, Cushing reflex. Also, we have oculomotor palsy, right? Okay, so this patient follows all trauma patients. We start with the primary survey. Primary survey comes first, which means ABCD comes first. So this patient need immediate secure of her airway. Okay, and because this patient is an elevated and impending herniation, elevated ICP patient, we have some targets, we have some concerns about her blood pressure. What is the target of blood pressure? Target of also carbon dioxide. We will discuss this later in other questions. But for now, after we stabilize this patient, we have a question. Should we neuroprotect this patient, or should we do CT scan? Okay, so the question actually is not an ED question. This is an ICU question, because immediately after we stabilize this patient, we need to admit in a place that has neurosurgical care. They will make the decision. Okay, by the way, this is an EDIC question. EDIC is a European Diploma of Intensive Care. Okay, so they will make the decision whether we have to do the therapeutic agents first, or we need to do CT scan to confirm the brain herniation or the cause of the elevated ICP. Okay, but for in real life, also following the guidelines, usually they will start neuroprotection. We will advise for hyperventilation with a target shown in the breathing point, 35 to 40, and also mannitol. Hypertonic saline comes after mannitol, and after that, after we stabilize the patient, we know in all trauma cases CT comes after stabilization, right? Okay, so let's see why wrong is wrong. So thiamine for the MRCEM purpose, we give thiamine in 3 or 4 condition as an emergent initial treatment. Can you remind me? So first, yes, is burning encephalopathy, alcoholics, also with anorexic patients, anorexia nervosa, severe malnutrition, right? And also with hyperemesis gravidarum. As we said, CT scan come after stabilization, mannitol, hyperventilation, follow the ABCD, and follow the neurosurgical advice. So let's move to the next question.